Hello and welcome to our look back at the financial year 2020 to 2021. This year, the impact of COVID-19 sent shockwaves across the globe and through our local communities. The staff at Epsom and St Helier, including the integrated partnerships of Sutton Health and Care and Surrey Downs Health and Care, were on the very front line of the fight against COVID-19 in our region. Our staff have helped us navigate through the uncharted territory of a global pandemic, giving their absolute to making sure our patients were well cared for and families facing the worst possible circumstances had the best and fairest opportunities to speak with their loved ones. It has been a heartbreaking year in a number of ways, but our teams have faced COVID-19 with courage, conviction, and a commitment to care that has simply been astounding. It is hard to find the words to describe this tumultuous and challenging year, from providing care to the very sickest of our patients in our intensive care units, to transforming a derelict military hospital to an inpatient rehabilitation facility in just 35 days. So this year's review is based on a selection of pictures from each of the 12 months. We hope these montages help all of Team Epsom and St Helier, Surrey Downs Health and Care, and Sutton Health and Care take huge pride in what they have been part of and help to tell our story of the past year. When the financial year began in April 2020, the nation was in the grip of the first wave of COVID-19. Our services were incredibly busy and staff were working in unprecedented circumstances to keep people as well and as safe as possible. Such was the pressure on our services that we had urgently needed to create additional space to care for patients who were dangerously ill with COVID-19, transforming the South West London Elective Orthopaedic Centre, where we would normally perform routine hip and joint replacements, into a temporary intensive care unit stocked full of ventilators and life-saving equipment. Admin staff were redeployed to help where they could, including staffing our donning and doffing areas, where clinical teams put on and take off their PPE that they need to enter COVID-positive wards. Working with colleagues across Surrey, we also began work to transform the derelict military hospital at Headley Court into the NHS Seacole Centre, a dedicated rehab facility for COVID patients. We were buoyed by the support of local people, including those who joined the Clap for Carers events, a blue light serenade from emergency service colleagues, as well as generous gifts from our communities. In May, our hard work to transform services began to pay off, and we saw a slow reduction in the number of people being admitted to hospital with COVID. The NHS Seacole Centre was officially opened by the then Secretary of State for Health and Social Care, Matt Hancock, who joined us virtually and was visited later in the month by the then Chief Executive of the NHS, Sir Simon Stevens. We were then able to close the temporary intensive care unit at the Elective Orthopaedic Centre, marked by an emotional morning when the last night shift of ITU and redeployed staff clocked off. 2020 was officially the year of the nurse and the midwife, and so we were keen to mark International Nurses' Day. We celebrated as best we could considering the circumstances and thanked our amazing team of nurses, midwives, and nurse support workers. There were lots to celebrate in June. Many of the services that had been paused as we all worked to overcome COVID-19 were relaunched, and teams began to return to their usual day job. For example, our audiology team were back to business as usual after many of their staff were redeployed to support the testing and swabbing of colleagues with potential COVID. Our theatre teams also got ready for action as we began work to kickstart planned surgery. To help ensure the safety of staff and patients as visitors began to return to our hospitals and community services, face coverings became mandatory in our grounds and buildings. We also celebrated National Biomedical Scientists' Day. Our biomedical scientists, who undertake a range of laboratory and scientific tests on tissue samples and fluids to help clinicians diagnose and treat diseases and evaluate the effectiveness of treatments, are a vital part of our team. During COVID-19, media interest in the NHS and the work we were doing was really high. We welcomed a number of film crews to the hospitals during this time, including a BBC News crew who spent a day at the NHS Seacole Centre to share the amazing work our staff were doing and to hear from patients recovering from COVID. We marked the NHS's 72nd birthday by lighting our hospitals blue and commemorated every patient who had sadly died as a result of COVID by lighting an LED candle. Staff lined the corridor to applaud Marilyn, a patient who was in intensive care for a record 112 days as a result of COVID. The teams were delighted to see Marilyn discharged and reunited with her family. As a special thank you to our teams and for all their efforts during the pandemic, a generous benefactor offered our staff to enjoy a luxury stay at a health retreat. Chairman Gillian had the honour of hosting the prize draw. Aside from COVID-19, there were some achievements and developments throughout the year that we are truly proud of, including receiving the green light in July to build a brand new specialist emergency care hospital at Sutton. The Building Your Future Hospitals programme represents the biggest investment in healthcare in the region for a generation. It will enable us to transform Epsom and St Helier hospitals and ensure that local people can access the care that they need, from urgent care to outpatient appointments and much more, in facilities that are fit for purpose. At the height of the summer, it was still all go at Epsom and St Helier. We celebrated the arrival of our new junior doctors, many of whom had given up their summer holidays to join sooner than planned, and a warm welcome in a virtual world. One of our wards at St Helier was completely transformed and reopened after an amazing refurbishment. Having already put in place measures to keep patients and staff safe whilst at our hospitals or using our community services, we also installed additional directional signage to ensure social distancing throughout our buildings. We launched our new 5-year strategy in September, setting out our plans for greater collaboration with St George's University Hospital Foundation Trust, as well as our mission to provide outstanding care every day. We also made a very public pledge to equality and being anti-racist. Our trust board unveiled the pledge, which is displayed on 2 giant banners at Epsom and St Helier hospitals. It reads, "The people we care for and the people who work here are from every race, ethnicity and heritage. We are proud to celebrate our diversity, support equality, and commit to being anti-racist in all aspects of what we do." But of course, we could not forget about COVID-19. Our staff continued to go above and beyond for patients, and we set up meet and greet teams at our main entrances, reminding patients and visitors to put on surgical grade masks and to sanitize their hands. In October, it was time to prepare for winter. The stocks of our flu vaccine arrived, and we pushed on in the clinical trial for a new COVID-19 vaccine. We celebrated the hard work and great results of our assisted conception unit as part of our Humans for Healthcare series. These are staff stories that help to show the person behind the role, and they're all available online. We launched a new campaign to support NHS Rainbow Badges. These are small pin badges that show our patients and visitors that our staff are a trusted ally for LGBTQ+ people. Thanks to funding from NHS England, we launched a new service for people with long-term effects of COVID, helping them to return to fitness. The Long COVID Rehabilitation Programme, which was the first of its kind in the UK, has now treated more than 400 patients. In November, the big news was that the Secretary of State for Health and Social Care reiterated the government's support for us to build a new specialist emergency care hospital at Sutton. We opened an additional CT scanner so patients with suspected COVID could be cared for in a separate area, and we were shortlisted for the prestigious Trust of the Year award by the Health Service Journal. We were delighted to welcome Professor Tim Briggs, CBE, Chair of the NHS Getting It Right First Time programme, and working with NHS England to showcase progress in creating new surgical hubs for urology, ophthalmology, and orthopaedics at Swelliok. Our teams marked World Prematurity Day, a day held to raise awareness of preterm birth and the concerns of preterm babies and their families worldwide. By December, it was clear that COVID-19 was making a serious comeback. It had been an unprecedented year, full of challenges, but as we closed the book on 2020, we knew the challenge hadn't been overcome yet. Our temporary ITU in the South West London Elective Orthopaedic Centre reopened, and staff geared up for the challenge of the second wave. Bongi Sibanda, lead educator for advanced clinical practitioners, was announced as a finalist in the Overseas Nurse of the Year category in the Nursing Times Awards. Our local communities continued to offer our staff overwhelming support, from the children who sent us handmade paintings, those who brought in essentials for staff struggling to find the time to shop, and the groups who brought us food. We owe you a huge thank you. By January 2021, the impact of the second wave was plain to see. At its peak, we were caring for more than 280 patients who tested positive for COVID-19. The high number of COVID-19 patients admitted to St Helier was beginning to have an impact on the hospital's 80-year-old infrastructure, including our piped oxygen supply. The system simply was not designed for the level of demand, and it took a mountain of hard work to monitor and maintain the piped oxygen supply and ensure that all our wards, including ICU, could continue to operate to national guidance regarding safe oxygen levels for patients. The first stocks of the COVID-19 vaccine arrived, and our chief nurse led the way in receiving the jab at the earliest opportunity. The Times featured our inspirational team at Epsom Hospital as they reported on the pressures of the pandemic, photographed by Richard Pole. But even heavy workloads and heavy snow couldn't stop our A&E extension progressing at Epsom Hospital. In February 2021, 1 year on from our first case of COVID-19, our vaccination clinic was well underway. By the end of the month, 4,500 staff had been vaccinated, and community nurses in Surrey Downs Health and Care and Sutton Health and Care had vaccinated more than 2,500 housebound patients. Community nurses from Surrey Downs Health and Care and Sutton Health and Care were out and about and helped to vaccinate more than 2,500 housebound patients. For the 8th year in a row, St Helier Hospital exceeded many national averages in the annual National Hip Fracture Database report, providing elderly hip fracture patients with some of the best care in the country. It took a lot of work behind the scenes to keep our services running smoothly during the pandemic. Our IT team issued 1,000 additional laptops so staff could work from home and rolled out brand new laptops on wheels for every ward needing updated equipment. The Project Wingman mobile lounge offered some well-deserved rest. In February 2021, 1 year on from our first case of COVID-19, our vaccination clinic was well underway. By the end of the month, 4,500 staff had been vaccinated, and community nurses in Surrey Downs Health and Care and Sutton Health and Care had vaccinated more than 2,500 housebound patients. For the 8th year in a row, St Helier Hospital exceeded many national averages in the annual National Hip Fracture Database report, providing elderly hip fracture patients with some of the best care in the country. It took a lot of work behind the scenes to keep our services running smoothly during the pandemic. Our IT team issued 1,000 additional laptops so staff could work from home and rolled out brand new laptops and wheels for every ward needing updated equipment. The Project Wingman mobile lounge offered some well-deserved rest and relaxation for staff. March 2021 saw the first anniversary of the country going into lockdown. We lit up our acute hospitals in a rainbow of reflection on the National Day of Reflection in memory of colleagues and patients who have died as a result of COVID-19. One of the biggest UK cranes helped position our brand new CT scanners at Epsom. We created an additional 12 clinical spaces for the emergency department and acute medicine so patients can see the right doctor first time rather than waiting for assessment or treatment. We updated the technology on our wards to allow staff to update information systems on the go. And with that, a year like no other came to an end. We know this year has been incredibly difficult for people, and we would like to take this opportunity to thank our amazing staff and those in our community who have supported us and the NHS as a whole.